Hi, my name is Adela Ali. I'm the CEO and founder of One Health. At One Health, we're an online pharmacy and healthcare platform that provides a digital infrastructure for payers, providers, and individuals to access medicines across Nigeria.
So my name is Mojola Ola, and I'm the founder and CEO for Great Crocs. And at Great Crocs, we build solutions that improve the ease and efficiency of energy access and energy management.
Hi, my name is Moses Mukundi. I am the CEO and founder of Eden Care. At Eden Care, we're building digital health insurance for employers in Africa.
Hello, my name is Joel Itua Ona, and I'm the founder and CEO of AfriWell Health. At AfriWell Health, we connect patients in Congo to their preferred healthcare providers.
I think some of the very important lessons that are particular for the energy industry is, first and foremost, I'll probably say a bit of a complex industry. So you need to understand that you can't do everything. And number one lesson is collaboration is key.
I heard a Minister of Health say he was not the Minister of Health, he was the Minister of Diseases. And that really taught me how important preventative care was. And I think that's the number one lesson I learned.
Insurance has an economic impact and a social impact that is sometimes overlooked. If you think about it, for a lot of families, if you had a big healthcare spend that was covered out of pocket, it would force a lot of families to sell their property. And once the family sells that one single property that they have, the second group that tends to be most affected is women and girls who drop out of school, drop out of their workplaces. So beyond just making healthcare accessible, we see this is empowering families, empowering companies to be more financially and socially sound.
And then thirdly would be, it kind of leans to the adaptability, would be listening to our customers and leveraging data. So from these data sets and from really watching, informed decisions are made. And this way, the care is holistic and we're able to really show the interventions and prove that it's working in terms of like health outcomes as well as survival for the end user. Most useful advice someone gave me is to never give up. Because I found that a lot of my breakthroughs that came through was just at the brink of, let me just try one more time. And that really was the game changer. So what we do is hard work, but it's important work. And knowing that resilience, I know it's probably a cliche, but truly resilience, especially in healthcare and in African context, is super important to break through the barriers.
Make a plan. Trust your instincts and adjust the plan as you go based on those instincts. And that has proven to be very helpful in remaining nimble or remaining true to the core vision of what we're trying to build.
As I was starting AfriWell Health, the most useful advice the people I was meeting with was be patient. The first time I thought, oh, that's odd, interesting. The second time I thought, maybe I'm not on the right path here. And then the third time and the fourth time. So all the doctors I was meeting with, all the clinics, so everybody was just like, this is great product, great platform. We are looking forward to working with you. We love the concept, but be patient.
Is integrity. And it's very, very important if you want to go far in this space to hold it very, very close to your I would say dear to your heart, and in terms of how you execute, not just integrity from your what is your bond area, but integrity in terms of sincerity in providing solutions.
The more healthcare means better healthcare, and what I mean by this is I talked about building more infrastructure, true, but building more hospitals doesn't necessarily mean we actually have more, at least better healthcare. We actually need to be more involved in the process, in the operations, because Then we just have new buildings that are fancy, and the reality is we don't always change the behavior of the doctor, of the nurses that are providing that health. And I do think that that's one of the myths we have in Africa.
So there is a general myth that, power is a social service, should be classed, in the same way as some other social services. And I think it's a myth that, especially, both from the consumer side, maybe in some cases the side of the government, is something that we need to sort of do some coming back again to education, do some re-education on.
Some of the myths that we hear all the time is that, number one, healthcare is expensive, and so no one wants healthcare. While there are some challenges in accessing affordable healthcare, there are now a lot of innovation that democratizes access to healthcare.
Being a Harambean means joining a community of people doing exciting things on the continent, people who bring different perspective to taking on a great challenge on the African continent. And being part of that ecosystem is really important for me as a founder, but also for my organization and the ecosystem that we're trying to build on the African continent.
Harambeans is really just part of being in this alliance, this collective understanding that we're here to do good, and we're here to ensure that the continent keeps progressing, that continent in 5 years and 10 years is not what it's going to be right now. And we're mission focused, very impact driven. I personally, healthcare access and access to quality medication is a must. I faced my personal problem from founding the startup was not getting my son's inhalers, and I knew the tears and the struggle that I faced. So imagine the millions of people and so many other founders in different aspects and different sectors as well. So as a collective, we are on that mission to make an impact, and we are standing by that.
Playing the key part, on the energy access spectrum by, the solutions that we provide comes with that deep sense of responsibility, that sense of collaboration, that being, Harambean brings. So it creates this consciousness and this readiness to work together with a bunch of like minds to ensure that together we can build, the Africa that we desire. We can build the Africa of our dreams.
My dream for the African continent is a continent that is empowered and is confident to take on challenges, right? If people feel they have the opportunity, if people feel that they can actually solve solutions in their communities, in their countries, then you will likely see a faster growing economy, more technology being developed on the continent, and a much more vibrant community on the continent. So for me, it comes down to people believing that they can, as sort of the primary basis to even giving them capital, etc.
My dream for the future of Africa, I'm really going to refer this to a very personal dream, and for my kids. So I have 3 kids today, 8, 4, and 3 months. Honestly, 0. And my personal dream for them is for them to be able to actually be educated in Africa, for them to stay in the culture, to keep building the success in Africa, build ventures or work in the corporate world, but be able to see a world, to grow up in a world where they see themselves live there and build for their own continent.
Helping businesses globally to experience growth, because it continues to remain one of the few continents where you could record double-digit and even in some cases triple-digit growth year on year, because the potentials remain untapped. So Africa is a place where growth abounds, and we can achieve that growth and also achieve prosperity for the continent as well together.
Vision for the future of Africa, obviously as a healthcare professional or pharmacist myself, is that every individual would have access to quality healthcare for long-term survival, right? And nobody would die or be left